say a 7 out of 10. I think it's pretty good. It's given us a lot of information about this study. And if I was looking for data on the impacts of COVID-19 or menstrual health access or issues of how finances impact health and healthcare, I'm already very interested in this study. It's given me a lot of information to go on, and now I can go read the full paper. So this is what I would consider a traditional structured abstract. This is, kind of your most traditional format. But for the next one, I thought maybe we could look at one that's a little bit more practice oriented. So I don't know who's doing the slides, but maybe we can click forward. Sweet, thank you. So I know that we are lucky tonight to have many clinicians and other healthcare workers on the call. So I really wanted to show an abstract that also is more focused around sharing practice and practical information. The study before was really that. It was focused on a study, but it is very important and very useful also to share the day-to-day operations of healthcare, unique things that you're doing, novel interventions, ideas that you have, because this is how, maybe the best practice of an individual or a team can become something wider over time. And so this is often done through these kind of practice-based abstracts. Now, you'll see that it looks kind of similar in terms of its format. It's 4 sections. The first and the last section are the shortest, and most time is spent in the meat, we might call it, of this abstract sandwich. So again, just starting with the title, already we're getting a lot of information. This is an abstract that's looking at the feasibility of GeneXpert, which I'm sure many of you are familiar with. It's a point of care testing system for sexually transmitted infections and same-day treatment in pregnant women. Great. We have a reasonable amount of information here. They haven't said where this study is taking place, but at least they've given us, what kind of project it is and what they're interested in. Now, in terms of the background, this one is even shorter than the last example, right? It's basically got 2 sentences. First, setting up the reason for this study. Testing for STIs at antenatal care aims to improve timely treatment and to potentially improve pregnancy and birth outcomes. There you go. 1 sentence to tell us why the study is important. And then 2, linking it to the work that they did, they say the GeneXpert system can detect several STIs and provide results within 90 minutes. It's unclear, however, if the workflow allows for same-day treatment. So in these short 3 sentences, we get some sense of why it's important, what the sort of question that they have is, and where they're going to go from there. So that's the first section. Now looking at the approach, this is where, as you could probably surmise, they describe what they actually did. In this case, they were looking at using the GeneXpert machine in a number of clinics in East London, which is a neighborhood in South Africa, specifically 4 primary healthcare clinics. They talk a little bit about the specific practices, taking the vaginal swabs as part of baseline antenatal care, how the machine actually works. So this one, as you can see, is actually quite different from the previous example, because they're really talking about the specific operations, how the machine works, what samples are needed, what tests can be done. And then what they did specifically, which is they asked women to wait for their results, and those who were positive were offered same-day treatment according to guidelines, with those who did not want to wait contacted via telephone. So this is very practice specific. Then we get into the third section. Again, this is perhaps the most kind of important, you might say. This is the new information. Although with a practice abstract, it's, I think, appropriate and good to spend more time, or more space, I should say, talking about the approach. But you can see here, now they're actually giving us a little bit of data too, which if you can provide data, you really should try to provide data if possible. It's not complicated what they're sharing with us, but it does help give us some indication. So for example, we know that in this 1 year period, they tested 511 women. And of those, about a quarter, 24%, were positive. Of those who were positive, 39% waited for the results and received same-day treatment. 34% returned for treatment, and 17% returned for treatment in a longer period, and 10% didn't return at all. So this one sentence with very simple frequencies and proportions has given us a lot of information about the gaps in treatment when using this gene expert machine. It's not good, I think, that 10% didn't return. But it is promising that nearly a third or over a third received their treatment in the same day. At one clinic, they say, with a spacious and quiet waiting area, 26 out of 27 women who tested positive received same-day treatment. At the 3 facilities without a designated waiting area, 18%, 26%, and 28% received same-day treatment. So again, we're getting actually quite a lot of information just in these 2 sentences. They are providing us with the proportions who received appropriate treatment. And I don't know if you noticed there, they slipped in a little bit of qualitative information about their approach as well, saying, contrasting the clinic with the really high same-day treatment, 96%, saying it had a spacious and quiet waiting area, and contrasting this with the clinics who didn't. So they're suggesting, and I'm convinced, I have to be honest, that this waiting space played a big part. You see, it's just a few words very craftily inserted into these sentences that gives us a lot of information about this practice. All right, sorry, I'm getting a bit, I love reading about research, so I tend to get a bit excited, but we'll wrap it up here by talking just about this last section, which is the conclusions. Again, this is where they bring it all home. What does it mean for the authors? Timely treatment of pregnant women with STIs was feasible, but most women with an STI did not receive same-day treatment. Then they challenged the gene expert machine as a rapid point-of-care device, or rather its ability to support same-day treatment, which is important for pregnant women with STIs, as I'm sure many people on the call know. They finish it all off by saying, efficient clinical infrastructure with a comfortable designating waiting area may improve provision of same-day treatment. I really like this abstract. This one I would give maybe an 8.5 out of 10. And I'll tell you why. Because it is simple, it is straightforward, it tells me something new, it gives me some information, some insight, and it does so with enough data that I can feel like, okay, this was a thoughtful and methodical process that these people went through. They've shared, I've learned, it's to the point, and it's easy to read. Making something easy to read is the best way to keep your audience on side. So these are just 2 examples, and the great thing about abstracts is they are usually publicly available. So even if you can't read a full paper because you have to pay for it or something, you can almost always read the abstract. And frankly, most people only read the abstract. That's all we ever have time for. So if you are interested in research, and if you're interested in writing your own research, the advice I always offer to my students is read. Read. Start reading an abstract a day, sign up for a table of contents for a journal, and you'll get the abstracts emailed to you directly, and just read them and see how other people are doing it, because everyone has their own style, and we can find ours. So thank you so much for listening. I hope you enjoyed these 2 examples, and yeah, that's it for me.
Thank you so much, Denton. Thanks so much, Dr. Adam and Denton. That was a very insightful presentation.
I am not done yet.
Okay, yes. Welcome and continue, Dr. Ari.
Okay. So I just wanted to add on to a last bit that is very important and which I mostly get asked and mostly be asked about, and that is we usually have quality improvement projects that usually happen through, and then we confuse the quality improvement projects with research. So we very well know what is quality improvement. So it's systematic data-guided activities. It's designed to bring about immediate improvements in healthcare delivery in particular settings. And these initiators of QI projects usually promise improvement. They implement small-scale changes, and they actually monitor results. But when it comes to research, this is systematic investigation, and it includes research development. It includes testing and evaluation designed to develop or contribute to generalizable knowledge. And research usually yields valid results through a rigid implementation of a fixed protocol. So, having said that, the similarity between research and QI is that they both involve systematic investigation, and it's carefully designed to achieve reliable and valid results. They both involve analysis of data, and they both involve implementation of a new intervention. Also, they both will result in a presentation or a publication. So this is where we need to look into how research and QI can be brought in together. So the projects that are quality improvement and research, they actually involve new intervention to improve patient care and analysis of data to establish scientific evidence of interventions and effectiveness. So if we are going to implement a novel approach that has not extensively been studied, we end up developing new quality assessment or measurement tools. We also end up using patient data so that we end up forming new clinical treatment guidelines, that is through QI projects. So many quality improvement projects use the traditional improvement approaches, and there is usually the post-study design and analyze the effect over time and control charts. So what was done before the study, you implemented the QI project, and what happened after. So that could be used as a research to see what was done before, what happened after, and what was the intervention that was used. So most QI projects, they usually use a study design with a quasi-experimental category. So the study design quasi-experimental category, it actually indicates that it's an intervention and it's implemented at a specific time, and it is known by the study team. So as I was mentioning, what was there before, what happened after, and what was the intervention that you brought in. So even if the study team did not implement the intervention, there's usually a hospital-wide policy change. So there's a policy change that has been done that is actually the intervention that happened. Or the QI study team implemented the intervention. So if there was a policy change, that is also an intervention, or there was actually something that the QI team did and implemented that intervention. So a quasi-experimental design overview, it's a simple example of quasi-experimental study with pre and post design, in which the QI study team records what was the outcome before the intervention, implements the intervention, and subsequently records the outcome after the intervention implementation. So with that, I would ask our moderator, Phyllis, please, can you moderate questions?
Okay, thank you. Thank you so much, Daktari and Dante, for that insightful presentation. I now open the forum for questions and discussions. And kindly, if someone has a question or comment, raise your hand. I will then call your name and then you will unmute yourself and present your question to the presenter. On the chat box, Dr. Adam,